CLASP is a program comprised of peer specialists who are people with lived experience in mental health and or substance use recovery that were professionally trained to support others in their recovery. CLASP specifically works with individuals who recently or are currently experiencing a mental health or substance use crisis. Individuals come to CLASP with varying needs ranging from connection to resources related to basic needs, connection to professional services, community support, and support with mental health stabilization. The most important need participants have is a need to decrease social isolation and for emotional support from someone who is understanding and empathetic. Peer specialists in CLASP are able to engage people and walk with them through their journey, embracing the principle of self-determination.
As a certified peer support specialist with the CLASP program at WCS, I am afforded the unique opportunity to use my lived experience to meet the needs of the peers that I work with and support. I have had the pleasure of working with Rashida for several months now, and from the very moment we met, we had an instant connection, and ever since then, we have just formed a sisterhood, really, and she has taught me probably even more than I've taught her, and so together we've just come a long way in our recovery.
I'm safe. I choose to be safe. I don't want to be, but I choose to be safe. And I thank Molly. She's like that code for card. I don't know if you've ever worked in a hospital where somebody, passes, not even passes away, but, start losing their breath. They got a card where it has everything on it to bring them back to life. And that's what Molly is. She's my code for card. She brought me back to life. So the program was pretty good.
Milwaukee County Behavioral Health Services developed and implemented CLASP in response to a growing need for short-term support and stabilization services for individuals post-hospitalization or after experiencing a behavioral health crisis. CLASP, providing assessment, linkage, and stabilization, has been a transformative addition to Milwaukee County Crisis Services through contracting with WCS, a local nonprofit agency. When CLASP was designed, peer support services was an emerging innovation, and therefore it was determined that CLASP providers would be peer specialists. Peer specialists have the unique ability to use their own lived recovery experiences to engage people in recovery and can lead to great outcomes. CLASP has consistently supplemented the crisis system by serving people who often do not engage in traditional services that are clinician-led, whereas CLASP is peer-led and clinician-supported. WCS's commitment to peer support and the valuable services being provided by the peer specialists has changed the system of care in Milwaukee, and it has engaged many people in recovery.
My primary role with CLASP is clinical, though I'm also a certified peer specialist. I have over 11 continuous years of sobriety from all substances. I live with anxiety, depression, and PTSD, and I'm a member of the LGBTQ community. This is what makes CLASP even more innovative because it makes it completely peer-run in every role, from the clinician to the supervisor to the peer specialist. It's rare to have peer supports not only in the entry-level roles, but in the clinical and supervisory roles as well. So we are truly able to all empathize with the individuals in our program because we have been where they are. Not only that, but our team is very diverse and we support folks from all walks of life.
I have 16 and a half years of recovery. I am a father, a grandfather, and a veteran of the United States Army. As a certified peer support specialist, I provide services to many people in our community with my lived experience, including brindamos servicios en español para nuestra comunidad hispana.
Wisconsin Community Services is committed to diversity, equity, and inclusion. We know that throughout the organization, great things are happening, which demonstrate how we embrace this work. We are fortunate to have dedicated and knowledgeable staff who are passionate about improving the quality of life for individuals and communities across Southeast Wisconsin, and our mission of supporting individuals and families in their efforts to overcome adversity. CLASP is a shining example of how we actualize our mission.
Well, I can say a lot. She's been an awesome aid of support, helping me get business done. So therefore, I'm able to take care of my daughter the way I should be. She's been excellent in connecting me to resources, providing me with resources, as well as a great emotional support as well.
It is important for me to share my story with others and let them know that being the program manager of the community-based peer programs is a very special thing for me because WCS has embraced me when I felt unworthy and limited in my options and employment. I now have a career instead of just a job. And I would like to share that with others so that they know just how far recovery can guide them to. I feel it is a passion of mine to support all in their journey to find their recovery with being unjudgmental and empathetic and caring throughout the process.